Hello everyone, welcome to Health Highlights. I'm Simon Ashley. This is a program about health professionals, and the people and the stories behind the names that we often hear about, but we seldom get to meet. And today it is a great honour to have Andre Vander Westhuizen with us. Andre is an oncologist, and I was just looking up some stats, and I don't know if you realise this or not, but 1 in 2 people will actually get cancer by the age of 85 in our community at the moment. And 1 in 3 women will get breast cancer sometime in their life. So cancer is a massive issue in our community, and it is such an honour to have Andre, who is a medical oncologist and geneticist. He's also doing amazing research at HMRI, to give up a couple of moments of your time to come and speak to us today. So thank you, Andre.
Thank you.
So we'll get straight into it. So can you just briefly tell us a little bit about what you do as an oncologist, just for everybody?
I'm a medical oncologist, but also a medical geneticist. My interest area is immuno-oncology. So immuno-oncology is really important in this day and age, because we use certain drugs, antibodies, to activate the immune system to actually make the cancer visible to the immune system again. So what happens, the cancer has amazing ways of hiding away from our immune systems, and we've now discovered that blocking certain checkpoints actually reactivates the immune system. The immune system then sees the cancer and then attacks the cancer. This is really important in specific cancers, especially melanoma and lung cancer, but also we're looking at trying to get these treatments to be effective in all other cancers as well. My area of research is specifically looking at why certain cancers are resistant to immunotherapy, first focusing on melanoma and patients who initially respond to immunotherapy and then become resistant, but also in people who are initially resistant to immunotherapy, finding ways to reactivate the immune system to attack the cancer.
And you also see people just generally as an oncologist too for breast and cancer,
yes,
and melanoma. They're your major specialties,
yes,
is that right?
Breast cancer, general gastrointestinal cancers, and specifically looking at integrating certain health behaviours with the cancer therapy as well.
Wonderful. So now we're sitting here at HMRI. Andre's just been talking to his team about the research they're doing. So Andre, you've sort of briefly talked about the immunotherapy and the power behind that. Can you sort of tell us a little bit about some of the results that you're seeing and the effectiveness of this research?
We've set up a very early phase trial. It's an early phase 2 trial to actually test patients who become resistant to immunotherapy, specifically looking at the melanoma population at this stage. And then those patients we are re-challenging with chemotherapy, but also with other drugs, epigenetic therapy, to reactivate the tumour to become sensitive to immunotherapies again. So we've got a patient on trial now, and we will expand that to a bigger group of patients, but also to other sites. The first patient we got on actually showed a response after becoming resistant to immunotherapy, with markers going down, as well as central necrosis or death in the tumour itself.
Mm-hmm. So what does this look like for the future of cancer treatment in Australia? Like, obviously the results you're telling us just before was quite amazing. So what's this going to do for cancer treatment in the future?
I think Australia has been leading in immuno-oncology, especially in melanoma treatment worldwide, if you look at the MIA and the results that we see there. But also the first trials that were done in Newcastle, the phase 1 Keynote 001 trial, as well as in Westmead in Sydney. So we are leading immuno-oncology, especially in the melanoma era. And it's kind of the poster for all cancer treatments into the future. So if we can find ways of dealing with resistance mechanisms, we can actually expand that to all cancers, and it's got amazing impact.
So what are the results you're seeing right now? Like, can you sort of share a little bit about some of the things that you're seeing?
Well, with the first, as we all know, the melanoma trials where the immuno-oncology treatment started coming in, 75 to 80% of those patients now survive 1 year. That drops to around 60%, 2 years, but then we also see long-term survivors.
Wow.
Some of these people are surviving 5, 6 years. Up to 10 years, we've got patients now surviving with stage 4 melanoma. So it's important that in those populations that become resistant to immunotherapy, we can then extend that survivals even longer and further out. And we can use those same principles to then move over to other cancers and see how we can get those cancers become really sensitive to immunotherapy as well.
Wonderful. Wow. So, Andre, one of your specialties also is genetics.
Yes.
And there's a big debate in our community about, well, with cancers, is it genetically caused or is it lifestyle caused? Can you sort of share your opinion on the difference between the genetic cause and, say, a lifestyle cause of cancer, just generally?
I think people overestimate the genetic inherited risk of cancers. It's not that common. It's only 5 to 10% of cancers.
Wow.
Where you inherit a gene in a family, where there's a lot of family members affected with cancer, or a person has cancer at a very young age. That's called inherited genetics of cancer. It's usually where you have 2 genetic mistakes for you to actually lose a gene that protect us from cancer. All the other cancers are sporadic, so those 2 mistakes happen in your lifetime. You're not born with one mistake. That can happen due to environmental factors, lifestyle factors, diet. It's really multifactorial. There's nothing we can pinpoint that can say this is the main cause of cancer. But we know that eventually the DNA repair process gets damaged. Cancer then becomes more prominent due to several mutations that develop due to that DNA damage, and then it builds up. So that's why we see cancers in the older generation.
So really what you're saying in that is that 5 to 10% is genetic and the rest of it is lifestyle or environmental factors that are causing cancer, which, wow, that's quite a significant separation there.
Yeah, 5 to 10% is inherited genetic, but the rest is sporadic, which could be genetics, but also multifactorial lifestyle factors and several other factors, environmental factors and exposures that can lead to cancer.
So what would your, to everyone out there, what would your top 5 tips be about trying to be cancer-free or maintaining a cancer-free life?
I think it's important to first look at your risk, your age, your family history, look at your exposures. Have you had any, maybe asbestos or sun exposure or any other high-risk things in your history? Then being very aware of your symptoms, knowing what symptoms are worrying symptoms that you need to go to the GP to go and investigate further. For example, rectal bleeding or lumps that you feel, or skin lesion that you see. So to go for those screening things really early, find the symptoms early, but so that you can get early treatment.
Mm-hmm.
The best treatment for cancer is early detection, surgical removal, and then aggressive adjuvant therapy to cure the cancer. So that's important.
Wonderful.
Yeah.
So Andre, you're paving the way in a lot of areas around oncology, and I was looking on your bio, and one of the things that you're involved in is the complementary therapies and an integrative oncology approach to cancer. So looking at both the complementary and the conventional treatments together, can you sort of explain a little bit about what that looks like in your world?
Yeah, I don't believe that complementary therapies alone or standalone can be of great benefit to cancer patients. I do believe that you need to have your conventional therapy and then integrate that with complementary therapies and then have that holistic approach to the cancer patient. That integration is a healthy lifestyle, diet, exercise, but also psychological factors that you need to work with the patient with, so that that person can actually maintain his health, withstand aggressive therapies that can help reduce the cancer burden, and then also eventually cope with the complications of therapy. So it's a whole holistic approach.
And so the benefits, and they'll say the limitations of complementary therapy, what would you say are firstly the benefits and then maybe a couple of limitations of it?
The limitations are that some people, firstly let's talk about the benefits. The benefits are that it basically builds up the person's immune system. It makes the person fit and strong to actually cope with cancer therapies when cancer develops. It helps a person to be able to recover easy from surgery when there's a big cancer surgery that needs to take place. So those are the benefits to maintain health, to actually withstand conventional therapy. The negative side is that some people do only complementary therapy or natural therapy and forego conventional cancer therapies and then do not get the results. So it's really combining the two and knowing how to combine that in a professional manner, appropriately, but also safely.
And I think that's the thing, is that you're looking at doing that, which in itself is a bit unique in the fact that you've got the complementary and the conventional coming together, which I think is a wonderful way of really starting to address this thing from a holistic perspective. It's great. So what would you say are the major factors around diet and lifestyle that we can implement to actually be preventative and also help during chemo? So what are those key things that you would say we really need to do?
I do think people need advice. I don't think anyone should do it by themselves. I believe exercise physiologists and physiotherapists can help to develop a program that can fit in with the cancer therapy and the time, and also the cancer burden. For example, a person with bone metastases may not be able to do the same amount of exercise than another person. So one has to really get the help of the complementary therapy professionals to integrate that into the cancer therapy.
That's wonderful. So you did mention there about exercise, and I know there's some research out that says that doing exercise during chemotherapy and radiation therapy is actually very beneficial. Can you maybe tell us a little bit about what you've seen and the benefits that exercise brings?
We know, for example, in the prostate, the breast cancer, and even the colorectal cancer population, there's significant survival benefits in patients who do exercise during or after cancer therapies. So I've seen benefits specifically in my patients who get integrated, that they gain confidence, they specifically aware of their limitations. They also know that if they stay healthy and fit, that they will withstand the toxicities and of the treatments, and that they can actually maintain life for longer and more effective because they're more aware of all their limitations.
Wonderful. So what would your recommendation be for someone who is going through chemo or radiation around exercise? Do you just say do whatever you want, or is there some guidelines that you have?
I would never tell them to just go and do their own thing. I would get them involved with the exercise physiologist. I'll get them involved with a dietitian, a complementary program. I'll talk them through things if they ask questions about if this is safe during treatment or not. And I'll also get the advice of complementary professionals if people want to go that route. So I think it's a team approach to get patients onto the right treatment path.
Well, wonderful, I love it. I think that's definitely the way that things need to go. So look, thank you so much for tuning in. If you want to find out more about Andre is one of the oncologists at the Mater and also at Lake Macquarie Private, and he certainly hangs around here at HMRI as well, so he can be contacted through any of those avenues. Look, thanks again for tuning in. We'll look forward to seeing you the same time, 12:30 Wednesday. Next week we have an incredible interview for you. So just remember, healing is a gift, health a responsibility. See you next week.
Thank you.